I can't sleep when I lay in bed. Too much thinking in my head. I don't know what to do anymore. Well, come on now, tell me the score. Is there anything I can do to get out of these tragic blues? I'm a victim of circumstance. I never really had a chance. I lay down and stare at my feet. You know the world has got me beat.
Welcome to today's edition of Mental Health Matter. Today we're going to be talking about aftercare for those that lost a loved one to suicide. We have a great show ahead. Thank you, Marilyn and Tony, for being a guest on our show.
It's our privilege.
Yes, and
Thank
I know
you for having us.
Okay, and I know you guys have a busy schedule, so I think that it's really important to talk about what we're going to talk about because this has not actually been talked about on our show. You know, we did some on suicide prevention, but we've not did anything as far as aftercare for the families who has lost a loved one to suicide. So I'm excited about what we're going to actually talk about. So let's talk a little bit about what is Friends for Survival.
Well, Friends for Survival is a peer-led bereavement support program for family and friends after a suicide death. So the qualification is that you have been affected by someone else's suicide death.
Wow. Okay, that's
So it's very broad because it might be your neighbor.
Exactly.
It might be a coworker. It might not be a family person, your family. But everyone, when there's a suicide death, a whole variety of people in different places are affected by it, not just the family.
Yeah, and I think that's a really good good component that you brought out, because I think about some people who, like you said, who have may been affected by suicide, but it may not be a family member, because just the loss of anybody,
Right.
overall, you know, anyone can be affected by that. So let's talk a little bit about what is your role in Friends for Survival? What do you do?
Well, in 1977, my son died by suicide. He was 18 years old and had 7 children, and he's the one I didn't worry about.
Oh, wow.
A few years, 3 or 4 years later, I met another mother at another bereavement program who had lost her 17-year-old son. And we kind of looked at each other and we thought, where do people go when there's a suicide? Because most people don't want to even mention the word. And this was in 1983. So we have been providing services since 1983.
Wow. So you pretty much got involved because of what happened with your son.
Right.
Very powerful.
Yeah. We both, Chris and I, the other co-founder, we were all right personally, but we just saw the need for other people and thinking, what are they going to do? You know, because we had supportive families and supportive friends, but not everybody has that.
Exactly.
And nobody was talking about it either.
Exactly.
Yeah.
And that's because the stigma that's
Right.
attached to it. So Tony, like, how did you get involved with Friends for Survival?
Well, my son took his life, Ben, in August of 2013, and the Sacramento Police Department and the chaplain came to my home, and they gave me an envelope with a lot of information in it. And of course, I didn't look at it for a while, but I did eventually find a pamphlet for Friends for Survival in that packet. But simultaneously, I belonged to Kaiser, and I went to see a therapist. And I had asked her if there was a support group that was specifically for suicide, because I knew it would be different than any other kind of support group. And she gave me Friends for Survival's phone number.
Wow.
And so I reached out and got to know them at Friends for Survival, the staff members and Marilyn, and started attending the monthly group meetings.
Oh, wow. Wow. I want to kind of piggyback a little bit, Marilyn, because you said that when your son the one that committed suicide, you said that he was the one that you were not worried about. You were worried about.
Absolutely. He was the compliant child, the nerd in the 70s,
Yeah.
who got good grades and
Yeah.
gave us absolutely no signs, and yet he planned this.
Wow.
He planned it. He wrote 7 notes. He didn't do it at home, and he wrote letters, notes. He said it wasn't anybody's fault. He just didn't have a future, which wasn't rational. He was already registered. He himself registered to go to Sac State.
Oh, wow.
So he knew when he graduated 2 months later, that's what he was going to do.
Yeah, wow.
So it wasn't the one you worry about. I want to say something about the word committed,
Okay.
because it's something that people have a tendency to use, saying committed, and it isn't something that survivors like to hear.
Okay.
Because most of the time, the word committed means something criminal, and it gets connected to suicide. And taking your own life is not against the law. Helping somebody is.
Yeah.
But not so. So we like to say either died by suicide, took their life, and we talk, instead of suicide loss, I try to encourage people to say death by suicide.
Yeah.
And,
Yeah.
and to also to delineate the differences between a survivor who has attempted suicide
Yeah.
and someone who's died by suicide.
Yeah.
That's two whole different types of outreach, and unfortunately we're so overwhelmed with the people after suicide death that there's no way we can also have a separate group for attempters.
Yeah.
Which is really needed in every community, not
Yeah.
just here in Sacramento, but any community needs that.
Yeah, and it's
Well, we
just
don't
as
have it.
important.
Absolutely it is.
Wow.
We're all at risk.
So let's, because it seems that in society we teach that, people that are depressed or people that are, people who may have anxiety or things like that, we try to teach on different things to look for those who may be ready to commit suicide. So how about we talk about, because to me that's very interesting that you said that your son was somebody that you wasn't really worried about.
No.
I think we will put more our focus on people who would fall into the category of showing those signs. Well, what are some of the signs that parents or loved one can look for of a loved one that are not showing those specific signs that we teach, so to speak? Does that make sense?
I'm not sure you're going to necessarily see something. Now, my story is not totally unique.
Okay.
There are other people who just are shocked,
Yeah.
as our whole community was when Stephen died.
Yeah.
He was a senior at Christian Brothers, and he was 2 months from graduation. I mean, it's senior year, you're going to graduate. It's a great time.
Yeah.
And any kind of little behaviors that might have shown a little bit of irritation, well, he's a teenager. You don't think seriously of that. But what I think what's important is what I realized a few years after Steve died is there was a history on his father's side of alcoholism.
Oh, okay.
And in the early years when I got married in the 50s, we just used to think of people should stop drinking.
Yeah, yeah.
But now we know that they're medicating their depression sometimes. They are medicating their depression.
Mm-hmm.
I think he inherited that vulnerability to depression and didn't know what was going on,
Yeah.
why he was feeling that way.
Yeah.
But also in those days, nobody talked about suicide. Nobody talked about depression with kids.
Mm-hmm.
I mean, who would have thought that kids got depressed? We didn't know that.
Yeah, yeah.
So the fact that we now talk about it and talk about the signs that are very often there, but most people don't kill themselves
Yeah.
when they're depressed
Yeah.
and have anxiety. Most
Yeah.
of them do not.
Yeah.
So you don't know who's at risk. So we need to take into consideration that we don't know who's at risk,
Yeah.
and just have an open conversation and make people feel comfortable in asking for help if they have some suicidal thoughts.
Yeah.
Yeah, and not just hide from it
Yeah. Yeah.
and suppress it, and then it blows up into what we had.
Yeah.
Yeah.
Well, let's talk a little bit more about the history, because I know you kind of talked about, the beginning of Friends for Survival. So let's talk a little bit, because I want to go a little bit more about into the history of Friends for Survival, because I think this is a very unique program that a lot of people, like myself, I did not know about it until we went to that steering committee meeting.
Yeah.
And when I heard you two get up there and present, I was like, wow. And my first thought was, I gotta get them on the show. That was my first thought, because I know if didn't know about the services in this particular program, I know there are others out there who didn't know. So I know.
Right, and I feel what you don't know, you don't know. I don't think people even know to ask.
Yeah, exactly.
I asked, as I mentioned, my therapist specifically.
That's awesome.
Is there a group for suicide? Because it's different than, a grieving group or,
Yeah.
a child that had cancer. It's all bad, don't get me wrong.
Yeah.
But just the shock of suicide, it gives you warmth knowing other people that have gone through it and they know your pain as well as you do.
Yes. Awesome. Awesome.
One of the problems with grief and related to suicide is the fact of the violence. The violence of the act.
Yeah.
You feel like they, most often, almost always, they died alone.
Yeah. Yeah.
Not like you were holding your grandmother's hand when she was 90 years old and dying.
Yeah.
This is different, and there are suicide deaths of all ages. Elderly kill themselves also.
Yeah.
The only difference is like 4 out of 5 suicide deaths are males. That's a huge, important statistic.
Yeah.
4 out of 5 suicide deaths are males.
Yeah.
But it's all ages. It's across all ages, and most of the time we hear about it on the newspapers about teenagers.
Yeah.
But we don't talk about the fact that a 30 or 40-year-old man is at a higher risk than a teenager.
Yes, exactly.
And when you get to be 60s and 70s, you're even at a higher risk.
Yeah, exactly.
Depending on circumstances.
Yeah.
So they may not give signs, as you were mentioning, but sometimes if you put together the circumstances that somebody is going through that
Yeah.
about, and you think, that's horrendous. How are they going to make it? You might want to think about, are they at risk for suicide? Do they have a support community around them?
Yeah.
Do they talk about how awful it is? Are they open about talking about it? Or are they just putting up a mask that everything's fine in spite of the fact that they've lost their job, their house burned down, their wife died, and you've got so many things going on, it's a hard time for people.
Yeah, yeah. I have a friend who, a really good friend of mine, that he battles opiate addiction. And one of the things that he always communicates to me is he never used the word depressed or depression. He always say that he's battling a down feeling. And that's, he communicate that a lot. And so in the beginning, I wasn't I wasn't paying as much attention to what he was saying as I am now, because now I'm much more educated. I have a lot more experience under my belt. And I've asked him a few times, like, do you ever think about like harming yourself? And I know he's mentioned to me before that it has crossed his mind, So of course, me being who I am, I'm really trying to get in there to really, to prevent him from harming himself. But it is kind of hard because a lot of times people don't really acknowledge what is really going on. But at the same time, these feelings that they feeling are real.
Oh, yeah. I mean, there are circumstances that are just so overwhelming that you can imagine why they could feel hopeless and think, everybody'd be better off without me.
Yeah.
Or I can't do this anymore.
Yeah.
There's been a chronic mental illness, severe chronic mental illness for years. I think people get tired.
Yeah.
And they get worn out. Families get worn out.
Yeah.
It's a hard place to be.
Yeah.
But most people who are depressed don't kill themselves.
Yeah,
You got to
exactly.
remember that.
Yeah.
But when they're open, like your friend, he may be at a higher risk than he would have been otherwise. And at least you got some knowledge.
Yeah.
And you've got a sensitivity toward it, which
Exactly.
is a safety valve for him.
Yeah, exactly.
It is. It's a safety valve. one of the things we've done over the years, and I must say I had nearly 5 years to cry and grieve before I started it. I never could have done this for at least 5 years. What we, in the process of the 34 years, we have served over 7,000 families.
Wow.
That have called us and
Wow.
asked for help.
Yeah.
And at the present time, we have 4,500 people getting our services.
Wow.
Mostly our newsletter,
Yeah.
but also we have meetings in Sacramento and Northern California. We have 7 meetings altogether. But, you know, when we started, I used to think it was going to be like my Girl Scout meeting in the living room or in the library or church meeting group, you know, just a small group. And we started out with 8 people in a living room.
Yeah.
And
Wow.
so who would have thought?
Yeah.
If I knew it was going to be taking all my time like this, I don't know. It would have scared me.
Yeah.
But it grew slowly,
Yeah.
slowly, but steady.
Yeah.
And I had no idea we had that many suicides in our area. I had absolutely no idea. And I didn't even know that kids killed themselves.
Yeah. Yeah.
In those days, the
Wow.
only thing you ever heard was victim number such and such dropped off the Golden Gate Bridge. And that was on the 3rd page of the Sacramento Bee with about 4 lines. And that's the only time people mentioned suicide.
Yeah.
So, you know, people aren't going to ask for help if the word's never used.
Exactly.
Yeah. So we just never knew it was going to get so big. But we really now, over the period of the 30-some years, the board of directors developed our program. We developed it ourselves, knowing what input we got from families, our own experiences, and all the board members over the years, which I'm trying to think of, about 30 of them, I think, altogether.
Wow.
You know, we used our own sense, I think, of saying, okay, what would be helpful? And we get stories and we think, okay, is there anything else we can do?
Yeah.
So we developed an array of support services.
Awesome.
Yeah.
Awesome. So Tony, at what point did it, or I guess I should say, how long did it take you to feel comfortable about sharing your story with the community about what happened with your loved one?
I pretty much eased into it. The first time I went to a Friends for Survival meeting in Sacramento was 3 months after my son passed. And the way Maryland has it is, you know, you go around and introduce yourselves and you say, you know, who died. And as the evening goes on, you can share if you want, and you don't have to if you don't want to, or you can say pass. You know, those early days, I mean, I still feel it is kind of early for me. It's 3.5 years now. You have days you can talk about it and days you can't. I feel like I'm in a good place right now because I've been going to these meetings. I went to a therapist for 2 years. I also took a death and dying class at Sac City, and now I'm in a loss and grief class at Sac City.
Awesome.
So I feel like I'm really doing my homework.
Yeah, you are.
And I think that's helped me tremendously. So I feel I like to talk about my son,
That's
and
awesome.
if people are tired about it, too bad.
Yeah.
But I would say, you know, I eased into it. But I feel like I pretty much, probably after the first few months, I could really, you know, talk about it.
Yeah.
People don't come up to you and say, well, sometimes they do, but it's rare that they'll say, well, what happened? What did he do?
Yeah.
You know, people just pretty much say, you know, they're sorry for my loss.
Yeah, yeah. Well, I think that you both are definitely doing a great work because, you know, it empowers people to come forth. You know, it empowers people to step forth out of their dark place, so to speak, and to gain courage to say, okay, you know, if this person have went through it and they're comfortable with sharing their story, you know, I can do the same thing. So it's good that your stories are bringing hope to different people.
That's exactly right, because I remember vividly thinking that first year when I went to Friends for Survival meeting, there would be other moms that have been going to meetings for 10 years or 7 years, and I remember vividly telling myself, if that mom can make it, so can I.
Awesome.
Because you think, how can you go on without your child?
Yeah.
You know, but I have another child.
Yeah.
And I have stepchildren.
Yeah.
You know, and you want to I tell myself over and over again, I don't want to be less of a mom to my daughter. I don't want to be less of a wife,
Yeah.
less of a daughter,
Yeah.
less of a friend. So, you know,
Yeah.
it's work.
Yeah.
It's definitely work.
Yeah.
Well, in our loved ones who died, in Tony's son Ben, when people do this, it isn't. They don't want it to destroy other people's lives.
Exactly.
You know, they're focusing because they have to. They can't do anything else at that point. Is they're focusing on their own pain, and you know, and suicide isn't about choice even. By that time, I don't know that they can make a good choice, a rational choice, and it's just that they can't do it anymore.
Yeah.
They just can't go on anymore. They think.
Yeah.
And, you know, we don't know if we were in the same shoes, in the same circumstances and everything, if we might feel the same way. We have no guarantee
Yeah.
that that couldn't even be us.
Yeah, exactly.
Yeah. And Ben and my son, they didn't want trying to destroy the rest of the family
Yeah.
or their friends. It's just, they couldn't see beyond that.
Yeah.
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 And you know, I sometimes say, you know, suicide is not about death. It's about ending your pain. They're trying to end their pain. They're not trying to die.
Yeah, exactly.
It's not about dying.
Yeah.
It's ending my pain or my situation or my circumstances.
Yeah.
I mean, we've had people call who's maybe the police are on the door and they're going to get arrested and they kill themselves in
Yeah.
front of family members or whatever. I mean, sometimes it's just desperation.
Yeah.
And
yeah.
they think, you know, I can't do this.
Yeah.
But
Yeah.
they're not trying to destroy anybody, and they're not being mean.
Yeah.
And it's not a coward's way out either. It
Yeah.
takes a lot to kill yourself.
Yeah.
So, you know, that's been, some people say, well, they're cowards and they just bailed out. It's not true.
Yeah.
No. They're usually very sensitive, caring, and often extremely creative people.
Yeah. Exactly.
And sometimes extremely smart.
yeah. Yeah.
So there's no common denominator. It could be anybody.
Yeah, and I have to agree with you too, because I went to a conference, it was either last year or year before last, and one of the presenters was talking about, I think he was it wasn't a medical doctor, it was someone who was in politics, and she was talking about how I guess some people had opposed the bill that they was try to bring forth, and what it was is the people had a legal right to end their life the way that they want to end it, meaning by like a lethal ejection and things like that. And so she was talking about how I guess this one guy, he wanted to go up like in a mountain somewhere, and I think his family members was there, and he took a shot or a drink and they, you know, injected him and he ended his life. He wanted to end his situation. And so that's kind of like what you're saying in a sense. It's just that he had another method of doing it,
Right.
you know.
That doesn't make it easier for our families when they plan.
Yeah.
I mean, assisted suicide, those families still grieve. And
Yeah.
It's still hard. It is
Yeah.
still extremely hard because, you know, we can say, you know, if it was up to me, they'd still be alive.
Yeah, yeah,
We all can say that. We just
Yeah.
think, you know, if it was up to us, we'd still be alive. So
Yeah.
one of the things that we do at Friends for Survival is we have three major purposes. And it's to comfort people, to encourage them, and then educate. Because unless you comfort them first and have some empathy for them, they can't hear education. So that's when they need encouragement about that time, because
Yeah.
sometimes they'll say, you know, I've been crying every day for 5 years and I just can't stop. And I say, well, you had that, you know, you had your son or your daughter or your mother for 40 years. You're not going to get over this in 40 days or 40 weeks or 40 months.
yeah,
And you just need to be patient with it. And the fact that you are grieving and crying and reaching out for help is a healthy thing.
yeah, yeah.
It's a healthy thing to grieve. And if you never grieve when somebody dies, somebody that you know and somebody you care about, I would be more worried about that.
yeah,
Right.
Yeah.
Yeah.
So having expressive grief is wonderful.
Yeah.
It's healthy.
Yeah, and it's not being weak.
No.
Oh, no.
absolutely
Yeah.
not.
No.
In fact,
Yeah.
it's strong.
Yeah, yeah. In order to bring out all those emotions.
Yeah.
It is, and I don't want to say you get used to it, but there's a lot of ups and downs. Sometimes when I'm driving alone in the car for 2 hours, I will let loose.
Yeah, wow.
I'll be fine for a month before that. I
Yeah.
mean, you just never know. Or people will have little triggers, little things that remind them,
Yeah.
and you got to cry. You got to cry.
Yeah.
Yeah,
you
for
got to
sure.
grieve. We have had callers that will call and talk to us maybe for 30 minutes or 90 minutes the first time they call. And we get at least average one new family a day.
Yeah.
And they will often say, my conversation with you, it might be me or might be any other of the staff that are assigned to answer phones and are trained. They'll say, and it's not uncommon for them to say, I got more out of this than I've gotten from therapy or for anybody else because you understand how isolated I feel. And you have some understanding of how painful this really is.
Yeah.
And so they need someone to talk to who's been there.
Exactly.
It's
That's
like
exactly
any
right.
other self-help group. I mean, AA, a bunch of sober police people attending AA,
Yeah.
that wouldn't work.
Right, it's not as effective. Yeah.
Right. No.
Yeah.
So the empathy and the peer factor are probably our strongest suit.
Yeah.
That is really important. And just to encourage them, saying, I understand about how you're still crying.
Yeah.
But, could you take a walk down to the corner and back and get some fresh air?
Yeah.
Can you maybe once a day go to the park and look at some pretty flowers? Did you open the blinds today? Do you have supportive people around you?
Yeah.
Do you have family?
Yeah.
And so we sort of kind of assess things and try to figure out what do they have that can be helpful to them besides us.
Yeah.
Maybe we might encourage them to go get therapy. Might
Yeah.
say, with all of your other problems you had, if they had a lot of struggles prior to this suicide death, now it's magnified.
Yeah.
But if they fairly had a kind of a normal, what might be considered normal life, when this happens, at least they don't have this other baggage
Yeah.
from years ago.
Yeah.
And
So-
that's where the group meetings help as well. We have 7 in the Sacramento area.
In Northern California.
Okay. So I want to get back to because I want people to know, like, just can you name different locations? I know Carmichael, Elk Grove,
And we also have in Chico, Yuba City,
okay, wow.
Cameron Park,
Yeah.
Roseville,
Auburn?
and Auburn area.
Okay, wow. I wanted to really highlight that because I wanted people to know the different locations just in case they may need one of the support groups in those
Right.
locations.
And the neat thing is that all of these meetings were started or were due to the fact that some of our families came to us and said, we would like to have one in our area because it's too
Wow.
far to drive into Sacramento. Could we do that? And then we set up teams, we set up training, and we put them in the newsletter, the monthly newsletter, with contact people, location, topics, and because we also try to do topics at meetings and try to direct the discussion because it is not healthy for people to sit in a circle and tell their own story from start to end.
Yeah.
Everybody else we've all got a horror story.
Yeah.
And we would be causing a lot of damage and to other people to listen to a horror story. We can't do that. So what we do is we try to focus on a different segment of the grief.
Oh.
The guilt, the anger. So every month we do something different.
Yeah.
And all of the outside line groups try to do that. Take a particular item, or you might say, is there something somebody's struggling with in the last month?
Yeah.
And then kind of let everybody talk and share about that.
Yeah.
So it's not, people can get scared and think, I'm not going to go to a meeting and tell my story. We don't want you to tell your whole story.
Okay.
But you can do it on the phone to us, one-on-one,
Yeah.
but not where you're going to traumatize the rest of the group.
Yeah. Yeah.
Right, and to piggyback on the group meetings and the topics, what I was going to share is an anniversary of the death is very hard. And that's where it helps in the group, because now that I've had 3 anniversaries, I'll throw out suggestions to the newcomers of what to do on an anniversary. I particularly like to do what Ben liked to do. So my daughter and I will maybe go to the Giants game.
Yeah.
Maybe we'll go to Bubba Gump's for dinner because that's what he liked. I'll also do something of that nature for his birthday. But we share that. And as well as October, November meetings are more focused on the holidays.
Yeah.
And what can you do to get through the holidays?
Yeah.
And again, we'll share, what we've done to help us get through the holidays. One thing that sticks in my mind, it was my husband's idea, is I had my son's, all of his baby ornaments all the way up until he passed. And, what did I want to do with them? So we have a little tree, it's artificial, and it's Ben's tree.
Yeah.
And the angel that he made in first grade is on top.
Yeah.
And then all his ornaments are all the way around the tree. And that helps. And
Yeah.
I'm probably going to put it up every year forever.
Yeah. Yeah. That's awesome.
So
That's awesome.
there are lots of really wonderful things that people can do that are helpful.
Yeah.
But you can't think of it when you are actually probably suffering from PTSD.
Yeah.
From the horror of it all.
Yeah.
And we have people who, the person shot themselves in front of them or something. I mean, there are some horrible stories.
Yeah.
And you've got to find some way to work with that and get to a point of some kind of a life. It's a different life.
Yeah.
Your life is never the same.
Yeah. Wow.
Absolutely never the same. So, it takes a long time. This grief after suicide takes years. We have many families, and I mean many, hundreds of families, that have been on our mailing list for over 10 years.
Wow. Yeah.
I did want to point out on the mail list, 4,500 go out a month, but it's nationwide.
Wow.
Yeah.
Yeah, it's not
Wow.
just Sacramento.
Yeah. Wow.
A third of them are Sacramento County.
Yeah. Wow.
And those early days for me, I could not wait to get my newsletter.
Wow.
It does share some personal stories, as well as some kind thoughts, maybe some poems. Mother's Day is next month, so in May, I think you put Mother's Day poem
I do.
in there or
Mother's
something.
Day
But
articles.
it's
Father's
just-
Day in June.
Yeah.
Summer issues,
Yeah.
things about vacations. Going on a vacation might be a hard thing to do.
Yeah.
Because you think, well, they should be here with us.
Yeah.
They were always with us. And
Yeah.
this is what we used to do. I just can't go. And some people can't even just leave the house.
Yeah.
About the holidays, one of the neat things one of our people suggested was that if you have to go to a family event, like they pressured you or you entered there, but you don't know if you can stay very long, park your car in such a way that you don't have to ask anybody to move the car so
Yeah.
you can get out.
Yeah. Exactly.
So
Exactly.
we try to do some common sense things for people.
Yeah.
Yeah, some common sense things that, otherwise our brains are so horrified and so traumatized that we can't think straight. People
Yeah.
get lost driving.
Yeah. Oh yeah.
for a
They don't know
while.
where they're
Yeah.
going sometimes.
Yeah.
Early on it's like my brain I just can't function. They can't sleep. We've even have a therapist who comes and talks about how can we improve our sleep.
Yeah.
So,
Wow.
lots of different topics like that. So we try to make it very helpful, educational, good suggestions. And so most people leave at our meetings with a smile on their face.
That's awesome. That's
Yeah,
awesome.
yeah.
So what are some ways that people can actually get involved? Are there any volunteer opportunities? Can people donate to the cause?
Oh, we would love for them to donate.
Okay.
Because the most expensive thing we have actually is just part-time. We have 4 very, very part-time people. One of them only works 1 day a week. So, and the Sacramento County for Mental Health Services Act does fund part of our staff.
Okay.
But the newsletter does cost a lot of money to put out. It's worth it,
Yeah.
but it is expensive, even at 13 cents a piece in postage
Yeah.
in bulk mail. And if we send it out of the area, it's like 18 cents.
Yeah.
Now, that's not a lot of money, but we
It
have
adds
thousands.
up. Yeah.
So, and boy, we are tight as can be. We run a very tight ship.
Yeah.
And Tony's one of our major volunteers now, and
Awesome.
she has been a right-hand person for me. Oh my gosh.
Yeah.
She's been doing absolutely fabulous things in the office, and and helping me after all these years. I'm not quite as fast
Yeah.
as I used to be,
Yeah.
you know,
Yeah.
after all these years. So there are lots of volunteer opportunities. We have people that just fold and tab newsletters once
Yeah.
a month that come in and do that. And,
Yeah.
then the people that label, there's anywhere from 8 to 13, and they have lunch afterwards and
Oh, wow.
discuss movies, and while they're labeling newsletters, and you know, it can be a happy time too.
Yeah.
You know,
Yeah.
and people are volunteering to do that. So, so she's been volunteering ever
Right.
since she took an early retirement, so
Yeah.
she could volunteer with us.
Right.
That's awesome.
Yeah.
As well as going to functions, like we'll set up a table at an Out of Darkness walk. We'll set
Yeah.
up a table. I set up a table at Sac City.
Yeah.
Wherever people reach out, you know, Marilyn will ask one of us to go set up a table and educate more people about Friends for Survival. Because as you're saying, they just have no idea.
Yeah, exactly.
They just have no idea where
But
they are.
why would you? Unless
Well,
unless you've been touched by suicide, why
exactly.
would you even think about it?
Exactly.
Exactly.
Yeah.
I mean, that's not the first thing on our minds.
Yeah, but it's still, in my opinion, it's still a good resource to have.
Oh,
Absolutely.
Because you just never know. You can, like we talked about, a friend could be affected by this, or, you know. So I personally, like I said, when I saw you guys their presentation, I'm like, I got to have them on the show because this is something very unique. You know, a lot of people do go and see therapists and different things, which is fine. But to me, just having that firsthand experience is more effective.
Yeah.
You know, in a sense for me. You know, because I want to talk about the children. Because
Okay.
I was reading on your website something about how children ask a lot of questions. And when they ask about death, it's something that they really probably don't have a good understanding about. So I want to kind of talk about how does this affect children, and what can we do to help even the children? Because sometimes, you know, we can forget about them and think that it doesn't really affect them because they're young. But they are just as affected as adults.
Yes, I remember when Steve died, and I had 6 other children. The youngest one was 2.5, and the next one was 12, and 15, 16, 17, 19. We were in such shock that I didn't even think about what my kids needed,
Yeah.
or how I could help them. I mean, I just couldn't comprehend it at all. And fortunately, a friend came by and sat down with the kids and talked to her themselves, just because her children went to school with my children. And so that kind of helped, and she asked if it would be all right for her to call a couple of the kids to come over and talk to one of the other boy that we had that was 17. And so other people kind of took that on. We do have, for instance, our speaker at our May meeting is going to be a woman whose mother died by suicide when she was 10 years old. She's now an adult and a therapist.
Yeah, wow.
And she is going to share at our May meeting on what that was like and how she got to where she is now, and she's written a book about it even. So, and about grief and suicide. So they are affected. We do not have a children's program ourselves.
Okay.
Because the Children's Bereavement Art Group here in Sacramento is fabulous. There's no way we can possibly do a job that would complement what they're doing.
Yeah.
They do a fabulous job. It's a free resource. They ask for donations, but it's actually a free resource.
Yeah.
And they have all ages of children from, is it about 5 to 17 or something. And they do them by age group, and they do art with it and other sculptures and that kind of thing. And many of our families have taken advantage of that and said, you know, it was really wonderful for their children, really made a difference. I think when it happens in this immediate family like that, you don't have the coping skills to deal with all of this other. You're just fortunate if you can deal with your own.
Yeah.
So somebody else needs to pick up the slack and kind of say, okay, what about the children and everything? And we do have a DVD that's been put out by Sesame Street
Oh, wow.
on children and grief.
Yeah.
And we often, if there's young children under 10, that's a free resource that we mail out to them.
Okay.
and it's got a book with it. And there are some books on children in grief that we highly recommend that talk about suicide and give you some ways to kind of, what do we say to the kids?
Yeah.
At what age, and how do we explain suicide to them?
Yeah.
And so, you know, there are some printed resources out there that parents can take advantage of. And they're such good resources, there's no reason for us to try to do that too.
Yeah, that's
Yeah.
well, that's good. That's good.
So we encourage them to get some help for their children, because you cannot do it on your own.
Yeah, yeah,
It's too much. You're so distraught that, you know,
Yeah.
and even if it's a grandparent, you know, I mean, it's a terrible legacy to lose a grandparent.
yeah,
And the grandchildren are affected by that. Nieces and nephews and cousins, and it goes on.
Yeah.
Neighborhoods.
yeah,
Yeah. I mean, when Ben died, the whole neighborhood was like in shock.
yeah.
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 So,
I want to talk a little bit about this quilt we have behind us, and
mm-hmm.
let's, because I love it. First of all, I want to say I love it, and I like. I don't know how did it come about? Who came up with the concept? And
it started back in about 1990. What's the first quilt we got up? 92, was it?
I'm not sure.
In the 90s anyway. It was a national idea that there's national conferences by the American Association of Suicidology across this country. Every year they're in a different place. They're actually, the end of this month, it's in Phoenix. And they were having a group of us that had lost someone to suicide. We were talking about what can we do? We need something. We
Yeah.
need something, you know, visible, something. And the short story is that we did our first quilt that year, and different key people around the country also did. So the next year we took these quilts to this American Association of Suicidology, which was a prevention. It's basically focused on prevention. But they found that a lot of grieving families were coming and wanting to learn something about suicide. So the next year we brought our quilts. Then, I don't know, maybe we had 15 or 20 quilts across the country that during
Wow.
that whole year that we'd worked on.
wow,
And the whole thing was that each family makes their own square. We have little packets with all of the information on how to do it, and we give them the fabric and everything. But those quilts made such a difference on the professionals, the psychiatrists, the psychologists, and the therapists, because even you've got to look at all those faces and all those dates and those smiling people that it's hard to comprehend that they would have died by suicide.
yeah,
It just doesn't seem I mean, you just kind of, it's just hard. You cannot imagine. And it was very quiet when they first saw them. They'd like in shock.
yeah,
For instance, on this quilt, I'm not saying anything privately because there is 2 quilt squares up there with 2 young men, one in a police uniform, and they're twin brothers that died by suicide, both of them. And their parents facilitate our meeting in Carmichael. I mean, not
Wow.
Carmichael, Cameron Park. And, you know, I don't know what it's like to have 2.
yeah,
One is, unimaginable having one. But so these parents have tried to make a difference for other people in spite of their own loss.
yeah,
So we do the quilts whenever we do trainings, whenever we have events where we can possibly put a quilt up.
yeah,
Like today.
yeah,
It helps people to have to
Right.
look at it. And Ben, she did a square for Ben on this particular quilt.
wow,
So we have 5 quilts
yeah,
altogether.
wow, amazing.
It's definitely a visual, because as much as we talk about it, you know, some people think, well, my child would never do that. Well,
Exactly.
guess what? Your child's up there.
Exactly.
I mean, you know, I remember my husband and I were like, this happens to other people. That's the night I learned we are the other people.
Wow.
That is
Yeah,
the night
it's
I
true.
learned we are the other people.
Yeah.
So do you feel like a person that go through this, or a person that lose a loved one to suicide, do you think that they are in a better position to maybe identify and maybe prevent this from happening to other loved ones, or you feel like it's just, you know, it's kind of the luck of the draw, you really can't tell, so to speak?
Well, first of all, survivors, people who have been affected by a suicide death, are at a higher risk for more suicides in their families. that raises, because it's like you said, it happens to other people, but now we know it also happens in our own backyard. It happens in our own homes, in our own families. I never would have imagined that.
Yeah.
So, but personally, I have a different sense on people. Sometimes, somebody you barely know or something, you'll say, how are you doing today or something? And they'll say, all right. And you get a sixth sense. There's something more. And I think sometimes other people do the same thing. We kind of look at things differently now, knowing it could happen to anybody, and we don't know whom. So I think we're more alert and have a different sense of it than I did before.
Yeah.
Absolutely. Absolutely. And Tony, I don't know if that's happened to you.
Well, I've had a couple people come to me and tell me their son is going through this or that, like I'm an expert now.
Yeah.
Well, first of all, my son was pretty much like Marilyn's son. I had no idea. He was not known to be depressed.
Yeah.
However, he did share with me a couple hours before he took his life that he had voices in his head.
Okay. Yeah.
In a way, I mean, I don't want to say the word good, but I'm not going to be the mom saying why, like so many are.
Yeah.
I'm not going to be the mom that said I came home and found him, because I didn't. He pretty much walked out our front door and did it.
Okay.
But he did explain to me there were voices in his head, and I can't even fathom. I just can't even fathom.
Yeah.
I mean, if I ever even gave advice, it'd be like, talk to your child. But you know what? I tried to reach out to my son and I said, let's go to the emergency. Let's do this. He wasn't having it.
Yeah.
He was 22 years old.
Yeah.
I tried to call 911 while we were having a 2-hour conversation. He grabbed the phone from me.
Yeah.
He was on a one-way tunnel vision.
Yeah.
And it was a little bit premeditated because he had his hunting gun in the trunk of his car.
Okay.
A week later, I did learn he did drive to the Golden Gate Bridge that day, because I didn't know there weren't any toll takers. I got the
Ticket?
The ticket, or the bill, if
Yeah.
you will, in the mail a week later, and that was the same day.
Okay.
So something was going on that just completely took over. He didn't look like himself. He was not on drugs. He did not drink. For his dad, I did have all that tested, although I knew in my heart of hearts, none of that was the case. Something just came down from wherever and just took him.
Yeah.
I don't even know how else to describe it.
Yeah.
He wasn't himself.
Yeah.
At all.
Yeah.
So.
Yeah.
It's just, we just have to realize that anybody could be vulnerable.
Exactly.
Absolutely.
Yeah. And not put it in a place of shame.
Yeah.
It's not shameful to go get help.
Exactly.
It's not shameful to say I'm really losing it. I don't think I can make this. I think I can't go on. If they say things like that,
Yeah.
that may mean suicide.
Yeah.
I mean, it's like you got to kind of look beyond their words.
Yeah.
And saying, well, what's going on, and just kind of talk to them and not feel like,
Yeah.
oh gosh, that's awful.
Yeah.
You shouldn't be saying that.
Yeah.
Don't say that. Don't say that to them.
Yeah.
In a way, though, I can kind of understand my son. It's like, you're going to go to the doctor and say you have voices in your head.
Yeah.
I kind of get it.
Yeah.
I don't understand that, that he did. Well, I do, but I don't want to.
Yeah. Yeah.
But, he had gone to the doctor a couple times for headaches, and it makes me wonder, was that part of it? I don't know.
Yeah. Yeah.
Yeah, it could have been the beginning, and I think people aren't going to necessarily say it's something they're hearing voices because it sounds like you're, quote, crazy.
Yeah,
which is
exactly.
not true.
Right.
Your
Yeah.
brain is malfunctioning.
Right.
Yeah.
Your heart can malfunction,
Yeah.
but so can your brain.
Yeah.
Your
Yeah.
brain can malfunction. It's not your fault.
Yeah.
It just
Yeah.
is part of life sometimes. And
Yeah.
so how do we get some help? What can we do? Let's at least try some things
Yeah.
first.
Yeah.
Let's
Right.
try some ways, and we'll help you.
Yeah.
I'll go to the doctor with you. I want to help you. I want to help you. And if the if the whole thing was reversed and it was us, they'd be trying to help us.
Exactly.
But they have to have the opportunity. My son didn't give us
And
the
the will.
opportunity.
They have
Yeah.
to have the will to want to do it,
Yeah.
you know, to
Yeah.
go. The police did tell me when they came to my house that they do get quite a few calls, and it's men between 18 and 25.
Oh, wow.
And they're just not sure what's happening with their brains.
Yeah. Wow.
Yeah, because it
Yeah.
would be scary
Yeah.
when you start having voices in your head.
Yeah.
I would be, I mean, I think I'd
Sure.
be terribly frightened.
Sure.
Yeah.
Thinking,
Yeah.
this doesn't seem right. There's something really wrong with me.
Yeah.
You know, it has to be horribly scary.
Yeah, but like the both of you said, it's not anything to be ashamed about. I
No.
think it's something that should be actually talked about and let them know that these things happen. You're not the first person that actually went
No,
through this.
there's hundreds
Right.
and thousands of people in the same place.
Yeah, and that's why it's important that programs like this exist, and also we get the word out about the stigma that's attached, because that prevents a lot of people from coming forth.
Sure.
You know, they're worried about how family going to look at them, how friends going to look at them, or will people think I'm crazy? You know, what peers are going to say, what peers are going to think if my friend finds out I'm going to see a therapist or a psychiatrist, you know. And so I think early on, once we get the word out about that, it's okay. It's okay to get the help that you need. It's okay to talk about it with your
Right.
family and people that you can trust and make yourself vulnerable. Well, it is okay.
And what you're feeling is okay, and you're not the only one that's feeling that. And,
Yeah.
you know, kind of make it matter of fact. You
Yeah.
know, let's get you some help.
Yeah.
Yeah, before they get in that deep dark place.
Yeah.
You know, and we need more support groups for people that are could share their commonality of mental illness, different kinds. I have a daughter who's disabled with MS, and it's been really hard for her. And I can't imagine what it's like now. She's in a wheelchair quite a bit, or a walker. She can't stand by herself, and she has 16-year-old twins. She's 52 years old. But there's a wonderful doctor, neurologist here in Sacramento, Dr. Schaefer, who treats a lot of MS patients. And he started with a grant, an MS Achievement Center, where she goes 1 day a week. And the neat thing was that after several weeks of going to that, I would ask her almost every week, how are things going? Oh, she's just, oh, that's wonderful. They do exercises and cognitive exercises and physical exercises on special equipment, and they have lunch together, and some of them are much worse off than some of the others, aren't quite. But the one thing she said to me, she said, Mom, I have friends now.
That's awesome.
And that really hit me because she was very isolated in that.
Yeah.
And I think when somebody is having voices or really severe mental illness, even mild mental illness, they can feel very isolated, like there's nobody around that I can talk to that understands what's going on with me.
Yeah.
So more peer support and done in a very effective way,
Yeah.
in a very way that we know can work and help one another, is really needed in a lot of different circumstances. So
Yeah.
I wish we would get to that.
I think
We're doing our little part.
Yeah, no, you guys are doing a major part. It may
Yeah.
not look like it, but trust me, it's needed.
Yeah.
I think they're more apt to share with a friend than their parents.
Oh,
Yeah.
absolutely.
Oh, yeah. Absolutely.
You know, I
The
mean,
peers.
we're all guilty of that, right?
Yeah. Oh,
My
yeah.
friend knows a lot.
Oh yeah. Exactly. Exactly.
Yeah,
exactly.
it's peers.
Yeah.
Yeah.
Exactly.
That's why in the schools, it's not mentoring program, I can't even think what you call it, but where kids are trained and the students know they can go talk to them, and then if there's a risk, they know to contact an adult to deal with it.
Oh,
But,
counselor.
Yeah,
at the
it's not
school.
a counseling, it's a mentoring type
Oh.
program that can be really helpful. So one of the things, I don't know how much time we have left, but
We got about a couple of minutes. So
couple
you can go,
minutes. So please, if you've had a suicide death, call us.
Yeah. Yeah.
It's confidential. We don't ask for any money at that time. we do in our newsletter later, but we don't ask for any money, and we will send you a packet of information that has our our newsletter. It has where the meetings are. It also has a booklet on grief after suicide. It has one about your health and grief.
Okay.
That's important.
Yeah.
And you will get that newsletter as long as you need it.
Okay. One quick question. So is the phone line, is it a 24 hours, 7 days a week, or is there a time frame?
Well, if it's usually like from 9 to 9 at 7 days a week. And if somebody who is taking the phone call or is assigned to take those days that we're not in the office,
Okay.
they will call you back, or maybe they may answer the phone if they're available at home. See, they're doing some of this at home.
Okay.
But we do have a voicemail.
Okay, and people would
so
get back to them.
we try to get back the same day.
Okay. Okay.
And try to get information out to them, and they can talk for as long as they like, ask questions. You know, we're all have had a suicide death, so we can be very understanding of what they're going through.
Okay. And thank you so much, both of you, for being on our show. And that's it for today's edition of Mental Health Matters. If you enjoyed the program, or if you would like a copy of this particular program, please dial 916-366-4600. Thank you.
When I think of where I've been, the good times and the bad, on a scale of 1 to 10, either way I'm glad, 'cause I'm not alone. As I'm reaching for the phone, your voice is there, you really care, you're my comfort zone. Sometimes when I'm lost, crushed beneath the pain, though I can't afford the cost, I just smile and play the game. But there's a healing place where I cannot pretend. Your smiling face, your heart's embrace heals me again. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song, and I simply can't deny that I'm not alone. 10,000 times I've known my best bet is that first step for hope. Trying to stand tall, I'm haunted by the past. With my back against that wall, one thing is clear at last. The kind of love you show to me flows from an endless stream, with shore so wide it won't subside. My mind had never dreamed how I'm not alone, even when I'm on my own. Your gentle touch is much too much to let me roll. So even when the storm is strong and I'm deaf to my own cry, I faintly hear a distant song, and I simply can't deny how I'm not alone. 10,000 times I've known my best bet is that first step for home. When I think of where I've been, the good times and the bad, on a scale of